But I think that at one time, dentistry in America there was this certain allure to it. Everybody saw dentists, working only 4 days a week, lived a very, very, very comfortable lifestyle. It was a lot different. But now, as student debt increases, I think everything is starting to kind of like mediate itself, and it's not as luxurious as some people would have assumed it to be in the past.
Yeah. So guys, I'm excited today. We have Future DDS with us, with Tyrell and Tyler, who are going to introduce themselves in a short while. Again, my name is Dr. Arnold. I run the Lancashire Smiles Instagram page, as well as the Dental Mentor UK Instagram page. And today we want to explore what dentistry is like in America, as well as sharing what dentistry is like in the UK as well. So thank you guys for coming on today.
Well, thank you for having us.
Thank you, man.
Just introduce yourselves and the Instagram page you're running, what you're doing at the moment, just so that people know about you.
Okay. All right. I'm Tyrell Friday, originally from Baltimore, Maryland. Fourth year dental student at Tufts University School of Dental Medicine.
And my name is Tyler Brown. I am originally from Atlanta, Georgia, and I'm a fourth year at Tufts Dental School as well.
And together, we're Future DDS. We run a platform basically helping students get into dental school, as well as telling a little bit about our experience going through dental school, and just sharing a little bit of our perspective to help anybody coming through the process behind us. So that's kind of what we do, or how, what Future DDS is. Sure.
Yeah, and guys, part of what's exciting about this is the fact that I'm going to be hearing these guys with their accents speak for the next 30 minutes. That's going to be enough for me. That's going to be it for me. And one of the things that I love about you guys is how you've covered so many dental schools in America, just going through dental students that go to those different dental schools, and that actually inspired me to start doing something similar in the UK as well. Before I wasn't so focused on covering each dental school, but after I saw what you guys were doing, I was like, this is amazing. I need to emulate this as well. So thank you guys for doing what you do.
Oh, of course.
Thank you, man.
Just tell us, why did you guys decide to get into dentistry?
So I think that very random. I don't think that neither of us have any dentists in our family. But on my end, I've always been very interested first in people. So I wanted a career that I could interact with a lot of people just to keep things interesting. And then secondly, honestly, entrepreneurship. I think that dentistry allows us, and granted, I'm not sure how it is in the UK, but at least in the US, we're able to start our practice literally right after we graduate from school. So that aspect of dentistry really was appealing to me and helped me make the decision on whether or not to pursue dentistry. So
for me, I was originally actually an engineering major, and I wanted to figure out how to make the environment more green. But once I got to Cal 3, it just wasn't really coinciding with what I enjoyed doing. And I wanted to work with people a lot more. Mm-hmm. So I went to pharmacy, thought about medicine, different things, but dentistry kind of stuck with me. I found a really good mentor. She just kind of explained to me her process of going through dental school and how her career kind of panned out. And I just, started getting more exposed to the career path and, assisting more and shadowing and everything, and kind of fell in love with it, So I always say dentistry found me as much as I found dentistry.
Awesome. I mean, for myself, I was going to the medicine route, become a medical doctor. But then I decided that, this isn't for me. I actually enjoy the entrepreneurial side, as well as the clinical side of healthcare, and dentistry just merged the two for me. Mm-hmm. But like you were saying earlier, you can open a practice straight out of dental school. In England, that's not a normal thing. Okay. So that's quite interesting. I'll be interested to hear about how that works for you guys.
Definitely.
So at 16, 17 years of age, we tend to start making our applications to dental schools. So that's getting the grades that you need to get into dental school. That's getting the work experience, and making sure you've got the other skills, showing teamwork, volunteering, that sort of thing. That's what you start doing at 16, 17 years of age. And then you get into dental school as you turn 17 or 18. What's the application process like for you at that sort of age, 16, 17?
Okay. All right, so 16, 17, I say you're probably like, getting your application together to go to undergrad. Maybe going to get a bachelor's degree or associate's degree, but definitely not dental school yet.
Okay, so explain that, because to us, undergrad means a degree. You can do an undergrad in biomedicine, you can do an undergrad in medicine, and undergrad in dentistry. So what does undergrad mean to you guys?
So basically, our undergrad, a degree, you can do anything, so basically I can go to school for business, go to school for art,
Spanish,
anything. And it's 4 years. You can do anything. And then after that 4 years, then you would apply to get your doctorate in dentistry.
Wow.
So we have an extra step. But literally, you can major or get your degree in anything as long as you take the necessary classes in order to apply to get your doctorate in dentistry. If that makes sense.
Okay, so that's at that 16, 17 years of age. That's when you start your undergrad.
Most of those 17, 18.
Yeah, so it's around, we finished up high school around 17, 18, and that's when you're figuring out where you're going to go to college or your undergrad university or college. Yeah.
All right. So you can't go direct to dental school. You got to do that undergrad. Okay.
Yeah.
And how does that undergrad get graded?
Just normal classes. You just, on the grading scale, I don't know if you all have like A, B, C, D.
Or pass, fail.
Pass, yeah. I didn't have pass, fail.
No, I didn't have pass.
Oh, okay.
Certain schools have pass, fail.
Yeah.
Certain schools.
Yeah, I think things are changing now.
Yeah.
Yeah. And the dental schools, how do they look at your application? So for us, it's your grades. You need the 3 A's. You need to pass an aptitude test. You need to show work experience at a dental practice shadowing a dentist. So these are the things that you need to be showing. For yourselves, is it similar?
Yeah, so when you finish up high school, at the end of high school, you take an SAT or ACT. And that's kind of like a test of, how well you can reason, comprehend.
It's not a good test.
It's just a standardized test. And that's kind of what they use to figure out if you're, if you can get into an undergrad university. So once you finish that, then you have to take the DAT, which is the dental admissions test.
Okay.
This is pretty much like all the classes that you took through undergrad, the prerequisite courses that you need in order to get into school is kind of all mashed up into one test, as well as perceptual ability. And then, so once you get that score, then you have to build the application of assistant, shadowing hours, volunteer. So you don't have to really focus on that as much until you get to undergrad. That's when you really focus on trying to get those shadowing hours and doing things like that. So you'll usually be around 20 or so, 19, 20, 21, around there.
All right. So right now, as we're approaching October 15th is the deadline to submit your application to dental school. After that, you can't apply for 2021 entry. So right now, students are looking at doing their aptitude tests and writing their personal statements. Do you have a cutoff point?
So different schools have different cutoff points. But traditionally, you want to apply earlier. Yeah. So when I say early, the application opens around June or May. So you want to apply as early as possible. But you can submit your application all the way up until, January, depending on some schools?
Like some schools, I think their cutoff is February 15th. Yeah. I think the last one is February.
When would the start date be if February is the cutoff?
June.
You'll still start in June. June or,
But
June, July.
So within those 3 months, or not 3 months, but 4 or 5 months, you'll interview. And then if you get in, you can start.
All right.
It's a fast process.
Yeah, it's a fast process. And this whole time, even before that date, they're still interviewing people. So, they're filling the seats as well. So do you guys have like a rolling application, or do you guys have a start date and end date?
Okay, so October 15th, everyone in the country has submitted applications.
Okay.
Nobody can submit after that. Right. And then from October to about March, dental schools are inviting you for interview, and then they start giving you offers as we're getting towards February, March.
Okay.
Yeah. And then you'll be starting in September. Everyone will be starting in September.
Got you. Okay.
And see, over here, different schools, like I said, they start different times as well.
We start usually like July or August is usually around the start date. Yeah.
Okay, so let's talk about that. I'm thinking, is that because you have more dental schools? So we have about maybe 15 or 16 dental schools in the whole country.
Okay.
So is it possibly because there are so many dental schools that things are like that?
Yeah, and I think within our dental system, we have dental schools that are private and public. And so with you being a private institution, you can really do whatever you want to do. And so that's where the varied start dates and application dates, whatever it may be, that's where a lot of the variety comes from. And every dental school kind of operates on its own decision-making process. So it's not like a unified type of system. It's more so like, okay, if I want to go to school in New York, they might do it differently than the people in Atlanta versus the people in Baltimore. Yeah. It's all different. And granted, there's a general consensus of what should happen, but all dental schools aren't really talking to each other saying like, hey, we need to do this. Exactly. It's not like a unified type of situation.
So you said there's private and public. So what's the differentiation there? What makes a dental school? Okay.
Money.
Public dental schools are a lot cheaper than private schools.
And typically the state.
Yeah, typically
the state. It would be like the state. So within our universities or our colleges, there will be public colleges as well. So you might have a University of Georgia, but within Georgia, there will be a private university like Morehouse.
Or Georgia Tech.
Georgia Tech. Exactly.
Actually, I don't know Georgia Tech.
Actually, yeah, Georgia.
I think they might be private.
They might be private. Regardless. And that really is what it comes down to as well. So like a public school will be more state funded, and typically their tuition rates will be lower. But a private institution, they're not state funded, and therefore their tuition rates are a lot higher. Exactly.
Okay, so does it match or correlate that because it's private and costs more, it's better?
No,
not necessarily. It's not about the experience that you're looking for. Yeah. For the most part, it's about the experience.
Okay.
Exactly. Yeah, a lot. I know, like, for instance, two of the biggest schools are private schools.
Exactly.
And so it's like a big network. You get a lot of like opportunities to do research. You get a lot more opportunities to do, maybe study abroad things where they're getting funding, and they're going out and making these connections to get funding for these things. Yeah. To equip the students to do it instead of having to go through government funding or only being able to do some to a certain extent because of government funding.
Right. Okay, so let's get into the fees then, because over here, all the dental schools have a max amount that they can charge a year. So for
what's that amount? What is that amount?
It's about £9,000 a year.
That's like what?
About 20,000.
20,000 US.
About $20,000, I think.
So that's the maximum a year that you can get charged for tuition fees over the 5 years.
Okay.
For each of the 5.
So 9 by 5, you're looking at 45,000 for fees for your dental school education.
And you're doing the 5 years from when you're applying at 16. So you're finishing up around 21 or so?
So you'd be starting as you're turning 18. So you'd be finishing at 23.
Okay.
And the total amount of money that you will owe
is about £45,000.
For your fees, for your dental school fees. But obviously there's now living costs as well.
Right.
Yeah, of course. Yeah.
Wow. Yeah. Okay, that's awesome.
Yeah. That's amazing.
That's awesome.
But the thing is, the government help you with a loan. Mm-hmm. So this loan, we probably don't even call it a loan because you only start paying it back when you start earning over a certain threshold. And even then, a small percentage is expected. It's like a tax.
Right.
Expected every year.
What's the interest on that? Do you all have interest on that amount?
On the loan?
So at the moment, I think it's 9%.
Okay.
That's about
9%.
Okay.
But generally, with the loans the government gives for degrees, if you don't pay it back within, I think it's 30 years, it gets scrapped.
Yeah.
Mm-hmm.
Yeah. So tell us about the fees over there.
All right. So 45,000 is probably like the average per year.
Wow.
Yeah. For a 4-year college. Certain schools are a lot more. Certain schools are a lot less. But for on average, probably like anywhere from 45 to like 60,000 for pure tuition is like an average. And then on top of that, the living cost for the city might be different things like that. So you're looking at a nice hefty difference in how much you're paying for school.
How'd you afford that?
I mean,
the government.
The loan. We get loans the same way. So, a lot of schools they give scholarships as well, but you get loans that are about pretty much 8%, and then you pay them back. You don't have to start paying them back until you get out of school. So the threshold thing, that's a little different. They have, I guess, a few programs we can do like.
But not even. I think after 6 months, you have to start paying.
Yeah,
something.
you have to start paying something.
Right.
Yeah.
You know what I mean? So it's no
but it
threshold.
might not be that much.
Yeah, so it's something whether based on how much you're making at that time. And after the 30 years, I think they scrap it, but they hit you with a tax bomb. Yeah.
Okay.
So you have to pay some sort of penalty for not paying it off.
On the remaining balance.
Man. All right.
Yeah.
Would you say it's how hard would you say it is to get into dental school? Would you say if you've got the grades, if you apply yourself, that's enough to get you in, or everybody that's applying has got the same academic ability and something else is making them stand out? What's it like?
I definitely think that everybody applying definitely has around the same grades.
Yeah.
Especially now. Now, of course, you're going to have some outliers, right? You might have somebody who didn't score that well on their test, the DAT, or you might have somebody who might have a low GPA. But in general, everybody is of a certain academic
level.
Exactly. So then, you have to start standing out in different ways. Now, some people, they might hold leadership positions, or they might have attended certain summer programs, or they might have a lot of experience.
Or done a master's.
Receiving more education to make themselves more competitive as an applicant. But in general, when you talk about getting into dental school, it is a pretty difficult process for sure. But, I mean, it's definitely doable.
For sure.
As long as you have the tenacity.
Yeah. You gotta be determined. You gotta be determined and persevere.
You have to be strong.
Things.
Exactly. But you can definitely make it if you really want to go.
What are some crazy stories you've heard of people trying to get into dental school and maybe not even getting in, or eventually getting in?
Man, I've heard of people applying like 4 or 5 years back to back. Like, I've heard people that have like flown across the country to go visit a school just so they can make sure they try to get an interview.
I have a crazy story. Whereas I know somebody who, applied, got a bunch of interviews, and literally the day before classes started, they got called to fly across the country. So that also happens a lot. Whereas, like we said, we have rolling admissions. So that means the dental school is literally calling people until their seats are filled. So last second, if somebody says, you know what,
I want to go here,
I don't want to even do dental school, they're going to call the next person who's on that list. And that literally might be the day before, or even in some circumstances during the orientation week. That first week, they might call people up. So it's really like the Wild Wild West. You really have to put as many shots that make sense. And see where you fall.
Yeah. Oh my days. Okay. And then dental school begins. For us, it's 5 years. In some cases, we've got accelerated programs, which are actually 4 years if you've got another degree. Would you say that all your courses are the same amount of years?
The program itself is probably the same. Because we're doing 4-year programs for dental school, but we have to do the 4 years of undergrad before. So we usually don't finish up until maybe like 26, maybe 3 years after you guys would.
Okay.
There's
about 3 years after you guys.
I think there's one school.
UOP.
One school is a 3-year program, but every other school is 4 years.
4 years.
And then of course, if you want to specialize, and that's if you want to do, you want to become an orthodontist, a periodontist, you want to do oral surgery. Those programs vary from like 3 to 5 years. Additionally, after school. So it's just a lot of, it depends on which route you want to take. Yeah, for sure.
All right. So, first year tends to be purely science, and then they start to give you a bit more clinical style work and lessons until maybe in third year, fourth year, and then fifth year, you're now seeing patients and starting to treat patients. Would you say that yours is similar in that it's very heavy on science at the beginning, and then they start easing you into clinical and then patients?
Yeah. I mean, yeah, for sure. But I mean, some schools are different, right? Yeah. So I remember we picked up a handpiece literally. Yeah, it was in our first couple of weeks. No, operative like September. So like within the first 2 months, we were doing clinical things, but we weren't actually in the clinic. Right. But we were able to, I think second semester or something, we were able to assist. Mm-hmm. So we would still spend time in the clinic,
seeing how the operation's kind of going.
Exactly.
Being able to like see procedures even though we don't know what's going on. Kind of get a feel of how a clinic day runs, you know, and see what to see the patient.
And that varies from school to school.
Yeah.
How big is your guys' cohort, your year group? How big is it? How many students?
Our school, so originally first year it come in about 200 to 210. Wow. And then in second year, it goes up to about 240. Yeah, about 240 when we get international students.
Okay.
Most schools, we're like the second biggest school, so most schools aren't like that. Yeah. The biggest school is about 400. That's NYU, and then but most schools are around 100 or 60 to 100.
Mm-hmm. Yeah, 60 to 100 sounds more like what we've got over here. My case is a little bit different because I went to a school that only takes graduates. So you'd have to do a science degree and then you go on to this dental degree. Okay. So there were only about 32 of us in my whole year group. So it meant a lot of interaction with the teachers.
Sure. That's good.
Yeah. Would you say that it was harder at the start in your first and second year, or it's getting harder now?
Oh, it was definitely harder at the start. Yeah, without a doubt.
Definitely harder.
I think it's the pressure too. You know, you don't really know exactly what the program is going to be like, transitioning to a new city or whatever the case is. So it's a lot more factors that kind of settle into place after first and second year. Mm-hmm. You know, and you know, I feel like it's less stress, less pressure on you.
And it's why you're here, you know. I think that while we're doing most of the science classes, you know, we're anticipating working with patients and things of that nature. So we're finally able to have our own patients. Things become fun.
Yeah.
Really good.
Putting it all together. No, I think patient contact was when dental school got exciting for me. Exactly. And I was like, yeah, I'm in the right profession.
Exactly.
Do you guys have like specialties there at the institution that you're at, or do you guys like how does it work for you guys wanting to specialize?
Okay, so in dental school you have specialists who will come in and teach you what they do in their specialisms.
Right.
But specializing is something that doesn't happen for a couple more years after you've qualified. So when you graduate, you all do 1 year. Which means that you can treat patients that have government-funded care.
Okay.
So you got to do 1 year, which is almost like a supervised year as a dentist. After that 1 year, then you need to do a minimum of 2 years in the government hospitals.
Okay.
And you're getting to shadow specialists within the hospitals.
Gotcha.
And then after that 2 years, you can apply to a specialism pathway. And that can then be 3 to 5 years specializing.
Gotcha.
So in the journey to specializing, you're working in hospitals, you're shadowing, and then you can get to become a specialist. But it's not something that we are in early on as dentists.
Okay.
Is that different for you? Because it seems like your specialism pathway is tagged on to your program.
For the most part, yes. For the most part, people that want to specialize right after dental school, you just like that last year, you're applying to specialty programs.
Wow.
And then you go straight into it. So if you want to do perio, you want to do oral surgery, you're applying at that time. So for instance, the only way you would do maybe a GPR or an AGD is if one, you wanted to get some more specialized, you know, some more supervised experience. or if you did want to eventually go and specialize. So that'll be a year for you to really get in there and get some more experience, maybe shadow oral surgeon while you're doing your residency, and then your application will be that much better the next time you apply.
Okay, so now the thinking here would be, it's still too early for you to know what specialism you want to get into. You've barely started treating patients. You don't really know what you enjoy.
Right.
So what's the thinking over there in terms of specializing straight away?
So, I mean, honestly, there's truth into what you said, in my opinion. But I think that a lot of people, especially in the U.S., a lot of people's parents are already dentists. So they might have been exposed, or they have some type of personal connection to their orthodontist, or, you know, they had some type of trauma and they went to see an oral surgeon. And so they might be connected that way. And then also, I think the money situation, right? So typically in the U.S., a general dentist will make not a lot less, but they'll make less than a specialist. And so a lot of people look at it as in a way, whereas I can do one procedure, do that procedure really, really good. Whereas, you know, besides oral surgery, like I might be, if I want to become an endodontist, I can focus on root canals, only do root canals. And on top of that, I get paid more to do that. So,
and I don't have to worry about necessarily owning the practice in order to make this amount of
money. Right. So that's really what I personally think is a lot of people's reasoning behind it, because like you said, we don't necessarily have that much experience in different specialties to really say, ooh, I love doing this procedure. So it's more so premeditated, if that makes sense.
I see. So is pay a big thing when you're a new dentist over there? Is there a big difference within your first year between everybody that's in the same year group, or is it all similar in terms of what you will all be getting paid in your first year as a dentist?
See, so it all depends. So for instance, if you go and you work in a government supported organization, you might be making, let's throw a number out there, $100,000, right? But if you go somewhere and you're working in a rural area, so basically somewhere not necessarily based around a city, maybe like 2 hours. You know, like 2 hours outside where people, it might not be as attractive to people. Instead of that 100, you could make 250.
Okay.
Exactly.
That's
so
a big difference.
Huge difference. And so that's it varies. There's a huge discrepancy.
Okay.
If you want to go do a residency, like Tyrell was speaking on, a GPR or an AEGD, you will only make $60,000.
Okay.
So yeah, there's a huge gap in the pay as a first year dentist for sure over here.
So let's make it a bit more relatable to people. So you were saying roughly 100,000 as a first year dentist. If you go to a rural area, maybe 250. What's the average salary of a new working professional in America? So in England, you're talking about 20,000 to 30,000 pounds a year is an average for most professional jobs. So for dentistry, it's one of the highest paid as a newly qualified professional. You're looking at around 30,000 pounds in your first year, and maybe 90% of the dentists are on the same amount for that first year. So yeah, 100,000, is that the expected for most starting professionals in America, regardless of profession?
No. Okay, so I mean, it's very hard to, like, I guess, put a number on it. I feel like in America, like 100,000 is kind of like a benchmark people shoot for. Once you get into like business or like get a higher level degree. Once you like invest in getting a high level degree, like you're kind of expected to like get to that bench part a few years out of school. You know what I mean? Like, and then you start getting more comfortable. So I'd say It's hard to say. It's very hard to say.
I would say honestly,
depending what area you're in.
I'll say average.
The average is probably like 60,000 though.
I'm
like
thinking 60,000.
40 to 60,000 for the average, pure
for
average.
The average, yeah.
Median income, salary income.
Right.
Yeah.
I think that in the world of dentistry, like I guess coming out maybe like anywhere from 120 to 160 would be the average.
Okay.
Salary coming out. So, but you also have to put into account that in America, like dental school is a lot more expensive.
Exactly.
So the investment that you have to put in up front is kind of like we're hoping to, I guess make it back on the back end. With.
Yeah. So it's interesting that you said 100 to 250, because over here for a specialist working in the hospital, 100,000 is an average amount. 100,000 pounds is about the average for most specialists working in the hospital. The interesting thing is if you work privately, regardless of whether you're a specialist or not, you earn a lot more.
Right.
Yeah.
So a general dentist who's doing private work can make between 100 to 200,000 pounds without specializing in one particular area. Doing private dentistry, maybe focusing on a bit more orthodontics, for example. Would you say that specialism then is the route that the majority of you guys will be going for, or it's just some new dentists that are going
definitely not the majority?
I wouldn't say the majority is going for specialties. I say the biggest thing now is just more so ownership, and it's more important to be an owner than to specialize right now. I think it's the general consensus of.
But even that, I think that. See, I don't think that many people want to own. Like, I think
that's true. I think more people want to go that route to try to make more money than try to specialize to make more money.
Okay, I see what you're saying.
That's where I think majority of people just want to be general dentists.
Yeah. Want to be associates.
Yeah, they want to be associates or be a general dentist, dental associate at an office.
And when we say associate, we mean working for somebody else.
Or in a group practice.
Or a group practice. Right.
Yeah.
So that's like the general thing. Like people will go partner up with another dentist. They'll work together, and that's the general way to go about things.
Yeah. Would you say dentistry in America is still a comfortable profession to be in terms of you can support yourself and a family, you can expect to get a mortgage, a house? Is it still regarded like that?
Yes, for sure. But I think that at one time, dentistry in America there was this certain allure to it. Everybody saw dentists, working only 4 days a week, lived a very, very, very comfortable lifestyle. It was a lot different. But now, as student debt increases, I think everything is starting to kind of like mediate itself, and it's not as luxurious as some people would have assumed it to be in the past.
Yeah.
I think it's definitely more of a long-term profession than people would expect. It's like, everything's a more long-term profession or something that you're really interested in and love. But at the same time, I think, again, just getting back to even financially, or being able to live a lifestyle that people would expect to see, that will take longer. So maybe not 5 years out of school, but 10 years out of school, that's when you'll start to see the difference. You'll be making more money, and then obviously you won't have the debt to deal with. So.
How's it over there?
Yeah,
how is it over there with regards to like the lifestyle?
Very similar. The dentists of 20, 30 years ago, they say that, things were a lot different. It was easier to own your practice straight out of dental school. You got more hands-on experience. There was less fear of litigation and getting sued. The fear now is that the new dentists are so frightened of being sued that they don't get to actually try out different procedures. So dentists nowadays not getting the same hands-on experience as the dentists of old, and the remuneration, the pay is not as much as it used to be. So that's the situation we're in as well. Would you say getting sued is still a big thing there? Because in dentistry, we've always heard that America is where litigation is the greatest. I think we might have overtaken you now, but is it still like that?
I want to say not so much. I mean, I've heard a couple of dentists have told me, within being a dentist, you're gonna get sued at least once. Yeah, it's gonna happen. But I mean, they spoke of it as if like you might get sued if you have a 30-year career, you might get sued 3 times, like once every 10 years. It's nothing to a point where hey, you're getting sued every 6 months. It's nothing like that. But I think also it's the same. Whereas because we have specialties, and like you said, we don't necessarily want to take risks. We refer a lot of things out. But I even think that culture is about to shift. Yeah. Because as a general dentist here in America, you can do anything
you're willing to do
to the certain standards.
It has to be standard of care.
Exactly. There has to be a standard of care comparable to a specialist. Yeah. So if I see a root canal that, I feel like I can do, and it's on the level of, or if I think my skills at the level of the endodontist at that particular time, I can try that and do it. And if it works, it works. Yeah. And so that's why, I think that now more so because a lot of general dentists are stepping out and I don't want to say taking more risk, but expanding their knowledge base to be able to do more. I think that, of course, there are going to be some slips and some bumps and bruises, whereas I think more suits will be coming along. But in general, I don't think that I don't think it's like a big thing.
It's not like a big culture.
Yeah, it's not a big culture.
It's like a craze of just like suing.
Yeah.
Okay.
For sure. No.
Yeah. No.
You talked about you could own a dental practice soon after graduating and qualifying. So how is that possible?
So you can actually own a dental practice while you're in school. You don't have to be a dentist to own a dental practice. Technically, to work there, you would have to, obviously to work there, you have to be a dentist. But it's really just if you can set up the infrastructure, you can technically own it. Just as if you worked at a dental practice and you decide to retire and just maybe take a portion or percentage, it's a similar way to that. Okay. Working in the office, if you feel comfortable with trying certain procedures and you feel like you can do enough where you're managing your overhead to be there and it's profitable, then go ahead and do it. Or if you can hire, maybe somebody, an older dentist that doesn't want to own the practice anymore, but you sell his practice and might want to come work with you for a couple years and teach you the ropes and not have to deal with the ownership aspect. So. And
it's also like, I think, especially in America, in order for you to get a practice right out of school, you will be betting on yourself. And so on top of the school loans that you already have, you're going to need to take out about on average another $1 million loan. And, granted, it sounds crazy, but, exactly. You're betting on yourself. And they always preach this to us. If you're trying to pay back your loans, the only way you're going to do that is through ownership. And granted, we're talking, I would say probably 60% of people do take out government loans, but a lot of people's parents are in the position where they're able to pay for their children's loans. So it differs from person to person. But for instance, if Tyrell or I wanted to start our own practice out of school, already we'll have this lump of loans on our shoulders, but we would say, you know what? Because we want financial independence, we want to be owners.
We're going to go find $100,000 liquid somewhere.
Because $100,000 is going to qualify us, or not even, maybe not $100,000, but we need a sum of money to take to the bank and say, hey, you need to loan us, or can you loan us $1 million to start this bank? And a lot of banks, or most banks, and this is what they told us, exactly, will automatically be like, yeah, we'll give you $1 million. Because dentists
realistically
pay that money back.
Realistically, that the practice could make $1 million the next year.
Okay.
Or in the next few years. So it's like they know they're going to get their money back at some point.
So they're just throwing out these loans. It's really just based on the person. And do you have the guts to,
can you go to sleep?
Yeah,
what I mean? With that much debt.
To put that money up.
So what I'm picking up is that you guys are more business savvy whilst in dental school, which is not a normal here. Ownership in the way you guys are talking would be the very small percent, maybe 1%, 0.5% of dental students who are thinking and talking like you guys are talking right now. If you wanted to start a dental practice here, you'd probably be looking at maybe having at least maybe 5 years or so of working experience before you start thinking about going to the bank to get a loan, that sort of thing. So that's quite interesting, that how contrasting it is.
That's interesting for sure.
Yeah. I think maybe the timeline probably isn't too much different. Usually it's about 3 to 5 years after you get out of school is when you start thinking about ownership. I think the percentage of people trying to get into ownership is probably a little higher here.
Yeah.
But it's not a bad, it's pretty similar timeline, I'd say.
Yeah. No, because I know that the video, I don't want to make it too long. I want to ask you guys, what are you looking forward to in your practicing careers early on when you've finished university?
I think a lot. I think more so. I'm excited about just establishing brand within my practice. And that's another thing in America, you can open up multiple practices. And so, granted, because of the COVID-19 situation, we haven't necessarily had that much clinic exposure. Granted, it's starting to pick back up now. So, I've been doing a lot of research just on like creating the team and, even looking at little things as far as like the layout of offices and how you want to run your business practices and how you want your office to run exactly. And so I think being in full control of all of that is one of the more exciting things, and just not being in school anymore. We've been in school for like what?
A whole lot.
Yeah, like 20 something years. I'm ready to be out.
Yeah.
Just having a little bit of freedom of the restrictions of school. Just like always having to, I gotta go take this exam, this license exam. Like it's a grind that it's always something to learn, of course. But like the whole school system, I'm kind of ready to get out and kick that system, man, and just start really putting some roots down. And like Tyler said, just establishing who you are as a dentist and becoming who I'm going, the dentist I'm going to be. That's the thing. It's like you can literally do anything or be any type of dentist you want to be. So once you really get out there, you figure out where you're going to be, procedures that are common or where you're going to be, the population, all those things. It's going to form itself into something. So I'm excited to really see like how that develops itself, the team you get to work with, obviously starting out, and the things that you actually pick up when you see what it looks like to be in an office every single day with the team. Like that's exciting to me. I like that.
With your guys' backgrounds and your families, is being a dentist a normal thing? Was it a rare occurrence?
Definitely. Like I said earlier, neither of us have any dentists in our family.
I found one cousin randomly, like last Thanksgiving. A couple Thanksgivings ago. So. But
I think it's like one of those things. Like once one person does it, hopefully the legacy. If they want, you can do whatever you want to do. But it's rare, but it's going to not be.
I think dentistry. No, I think just striving for some type of higher education. That's kind of something that's been instilled. So like literally my graduation day, my mom said, "So when we going back?" So it's like it's just little things like that. Where I'm sure she was joking at the time, but it's just something that just sticks in your head. Like, all right, there's nothing you can get to. If you're going to go education, go to the top level of education you can get to. You want to play sports, get to the top level. If you're going to do business, get to the top level. Like that's always, that's how you're going to do it.
Yeah. No, thank you guys for this. I love your energy. You're clearly driven. Guys, you know what you want. You're going to go get it. It's been exciting getting to chat with you. There's so much more we could talk about, but just with time, and I know you guys have to jet off to carry on with your studies as well. So thank you for coming on today. And guys, make sure to check out Future DDS. I'll put the details in the description below, and let's keep on contact.
For sure, definitely, man.
Thank you so much for having us today. This is awesome.
Fun. Yeah.